Next studied material inside of the control. Is it logical or not? Of course. Alvin,
Present, sir.
Shaya, Aisha,
Present,
Anna Maria,
Present, sir.
Ashutosh,
Present, sir.
Aswani,
Present,
Rain,
Present,
Brilya,
Present,
Devaraja, Devananda, very soon. Esther, Kevin, Hera, Nasrin, Raisa, Rushikesh,
Present, sir.
Sariga, Steffi,
Absent.
Fatima, and Festina. Do you have any questions from previous material? Please, guys, don't afraid to ask the questions. If you have any problem, ask me. I will do my best to explain. No? If no, write the name of the new topic. Lumbar region, retroperitoneal space. Generally, this is last two compartments of abdomen, yeah? Because previously we studied first two is anterior wall and peritoneal cavity. Now we study posterior wall together with posterior cavity, yeah? Okay, first of all, as usually, I must introduce and explain you importance of the region. Importance mainly from surgical point of the view. Point number one, that is the place of the main access into the retroperitoneal organs. If you want to open kidneys, suprarenal glands, sometimes there's some digestive structures like the pancreas, for example, yeah? You can do it not only from anterior wall, but you can do it also from posterior wall. Another question that from posterior wall it's not so, let's say, comfortable, because you understand that very many bony structures we have, primary by midline, it is your vertebrae, upwards we have the ribs, and what the difference of the ribs in anterior and posterior wall. In anterior wall they forms the angle, it is epigastral angle, and they forms the aperture, yeah, which you can use, I mean space. In the back wall they have approximately horizontal localization, I mean the 12 rib. And that's generally it means the difference of the sizes between anterior and posterior wall. Anterior wall is enlarged and to upwards due to the presence of the, and to downwards due to the presence of inguinal ligament.
Mm-hmm.
In the back wall from down we have the crest. From above we have the 12 rib.
Yes.
That's right. If you will compare the size of the posterior and anterior wall, you will see that anterior into 30, 40, up to 50% bigger than the posterior wall. And that is happened due to the replacement of the superior and inferior borders, due to formation of the angular shaped structures. In the back wall, we don't have angles, we have the lines, horizontal shaped lines. Let's say point number one, why it is important, it is for surgical access. Point number two, guys, on the posterior wall, we can see pathological disorders. For example, formations of the lumbar hernias. So remember, please, hernias we can have not only in anterior, but we can have in posterior wall. Of course, it will be herniation from a retroperitoneal space. By the way, not only hernias from retroperitoneal can come, but also pus. Retroperitoneal abscess from weak places, which I will introduce you a little after in the posterior wall. Posterior wall also have weakness. Posterior wall has natural weak places like anterior wall. Can you remind me what is called the natural weak place of the human body? Why some places of our body have low resistance and we call them the weak places?
So maybe the recovering time is more.
Do you appreciate it, dear answer? If the recovering time, for example, the worst recovering time have the bone tissue. In your opinion, bone is weak?
No, bone is not.
But its recovering time is long.
Due to the pus.
Friend, you are not the Vesalius. You are even not the Leonardo da Vinci. Why do you think that you are responsible to create some news in medicine? Well, instead of it, maybe it will be better if you will study the materials. Because you see, their logic doesn't. Guys, in which case logic can help you? In which case? This is philosophy question. In which cases logic can help you? Please, dear, that is just conversation. I don't speak about medicine. Tell me, please, all fields, areas of the human research, investigations, then you can use your logic. You see, even in this, if you cannot answer in such kind of common questions, how you can answer in the special medical questions? Please, dear, you're a clever person. Tell me, please, in which cases, you are all clever and smart, but he has logical thinkings. Tell me, please, in which areas, in which fields we can use our logic? And in which fields it's impossible?
Like in medical field,
It's very possible. It's very possible to use the logic in the medical field. Again, but I don't understand your options. I don't need to listen exactly name of some field. I need to listen your explanation. In which cases we can use the logic, in which no. Guys, use your gray matter or you will lose it. Who can answer in my question? You, my dear. In which spheres of your life you can use your logic? Please. Options. Guys, I will not kill you. I just want to speak with you. Tell me, please, in which parts of your life, in which spheres, in which questions we can use the logical our thinking. So, daily. What is this daily activity? Daily activity in case to prepare breakfast you need. Do you need the logic to prepare your breakfast? I don't understand what do you mean then you mentioned the daily activity. Daily activity, if I go to the bus stop and sit it in transport, in your opinion, I need the logic? This is the routine work. Why I need the logic for that? What is the logic? Explain me, what does it mean logic?
For that particular thing, like saying.
Fantastic. We come to the final situation. Okay, you don't know the medicine, but you don't understand what is the logic. It is possibility to make analysis, synthesis, and conclusion. What I must say after? Analysis, synthesis, conclusion. What I must say after? On the base of the previous knowledge which I have. That is the basic question. I can use the logic only in the fields which I know. Only in the fields which I have the knowledge. Sorry, in the fields which I don't know, as she don't know the medicine, logical thinking is impossible. If I will speak now about the quantum physical rules, can you say me logically your opinion about these questions? Hardly. Because you don't know, and I don't know. It's like all my logical conclusions in this field will be impossible. But why I interrupt him and say that in the medicine it can be easily used? The question, for who? For who? For a person who has the knowledge, of course it is very easy to make any logical conclusions in the medicine. Vice versa. In the person who don't have the knowledge, it is totally impossible. That's why remember, guys, when we speak about logics, we say that this is the conclusion, this is analysis and synthesis in the base of previously achieved knowledge. Only in that. That's why, friends, don't live like in some US movies. In the US movies, I see many times that teacher asks the children, speak, don't worry that you don't know. Speak. I call it, guys, the wind production. I'm very sorry, because speaking without knowledge, it is just the wind. It's nothing more. It is voice. It is not speech, it is voice. Understand me, guys, don't make the voice, dear. You're not the, I don't know, some voice equipment. Why you do it? Of course, weak place, it is not what do you say. Weak place, it is parts of the human body with absence of some layers. Doesn't have any attention with the regeneration and anything else. If inside of some regions, layers absent, we will achieve the natural weak place. If you will violate these layers, it will be artificial weak place. Give me example of artificial weak place. That is fantastical. Dear, if every day I will come to you and will tell you one single topic, but in the time of my speech you will sleep, tell me please, what will be value of my work? Tell me please, what will be value? Evaluated it from point 1 up to point 10. Every day, day by day, I come to your home and teach you the topic about inguinal hernias, but in the time of this teaching, you sleep. What is the value of my work? From 1 up to 10. Evaluated it, please. Please, dear, can you speak? That's why now we are in the same situation, because 100 times I spoke about this, and you cannot just now repeat it. It means you normally, naturally, not listen me, but sleep in the time of my lessons. That is only conclusion which I can make. Because dear, then you cut any structures, in the future scaries form here. Scar it is artificial weak place, because instead of the normal layers, only one connective tissue is formed. And that's why we call it artificial weak, or you can call it post-surgical or post-traumatical, because we can have damage or after the surgery or after the trauma. Tell me, prove me please, why your own umbilicus, it is natural weak place. Your own, not mine, your. Or maybe you are not agree with me. Maybe you will prove me that it's very strong, it's not weak. Friends, that's awful. Then your father speak with you. You also close your mouth and don't make. Now, of course, I say that voice production is not good. But can you say, sir, I don't know, or sir, ask another question or something else? Why you keep silence now? What? 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 Why you move your head? I must listen your option. Why you move your head? What, friend? What? Let's say, do you listen my question, or it need to be repeated for you? So what is your option? Why your own umbilicus is weak? Sit down, wait me 2 minutes.
umbilicus में तीनच लेयर्स है, बाकी जाके फ्यूज होता है एका लेयर.
Describe you why your umbilicus. Please. Sorry? And do you think that in our body the most powerful tissue is subcutaneous one?
No neck.
That is your help for him? Awful. Don't use their help here. They will not help you. Yeah, fat is absent, guys, but in my opinion, loose fat, it's not the strongest protection for the layers. Huh?
It fuses like
Who eat? So? Umbilicus? What is umbilicus?
The layers fuse together.
That's which layer is absent there? What is the most powerful
Muscles.
layer?
Sorry.
What is the most powerful layer which is absent in the region of your umbilicus? How do you see it? Even 5 minutes without teacher or 2-3 minutes is not enough for you to live. Friends, I love you very much. I say it many times. Why I repeat it always? To be understandable for you. I don't make bullying here. But if I will not show you your problems, tell me please, who will do it? Can, for example, your relatives, if there are not doctors, or even if they will be doctor, what do you think? They will make your examination to understand do you have problems or not? You know what is the problem, guys? You are not responsible to understand how serious problems you have. Otherwise, you will be very weak in my class. You will not normally sleep in the nights. You cannot normally eat your food. Why you cannot? Because you will be in chronic stress. You will understand that you waste the money of your parents. You don't recognize, guys, what are you doing? You're so funny. You're usually laugh when I speak with you. You enjoy your time. I'm sure you normally sleep. I'm sure you normally eat. I'm sure you don't have any some psychological disorders. But you must to have them, dears. You must minimum to have the stress. Because how is it possible to study 3 years in medical university and don't know what is absent in region of umbilicus? Look, you study anatomy, you study top anatomy, you study the physiology, which is described, for example, the muscular structural specificities. And until now, 3 years in medical university, you don't know that in umbilicus we don't have any muscles. And you don't understand that the muscles is the most powerful protection against formation of the hernias. Now, you, my friend, prove me, please, that the muscles, it is the most powerful structures. By the way, in the region of umbilicus, we don't have muscles, but we have aponeuros. Yes. The peoples who eat the meat will prove that aponeuros is not so easy to chewing, comparable with muscles. It is strong. But God knows why now I say that muscles is better protection than aponeuros. Is it some logical mistake? That's it. Prove me if aponeuros is really more dense, more strong, why presence of the aponeuros make the region weaker? And vice versa. Why the presence of very tender muscles make the region stronger? My question is understandable.
Yes.
Please, who have the option, I will be ready to listen.
Maybe due to elasticity?
Of course. Now make the simple experiment in your home. Take any plastic bag and push it by your finger. The bulb will be formed, which will not be anyhow reduced, because it doesn't have elasticity. Your tendons, your aponeurosis, it's unelastic structure. What will happen with muscle? Take the rubber gloves and make the same, press it by your finger. Again will be the bulb forms, but then you will remove your finger, it will be constricted and will take the normal form. Your muscles, like this rubber structure, have the elastic qualities. They have elasticity. That's why then something compress our muscles from inside. Firstly, they protrude, and then the pressure is reduced. They reduced also. In case of aponeurosis situation, another, I press it, or I protrude it, or I split it
Split.
into the fibers. You see, in our life, guys, usually you think the more dense, the more strong. No, no. In case of formation of the hernia, this doesn't work. We have very tender structures, which is very strong because they have elasticity. That's why again, let's come to my question, which I asked our friend. What does it mean, the weak place? Place without lips.
Yes.
That's a little after you will see that in lumbar region we have some compartments without muscles, without some muscles. And this will make these regions weaker comparable with neighboring regions. And it will be the place with low resistance, the place with formation of protrusions. Understand it, guys, that is not so hard. That's why number one, region is important from the point of the view of surgical access.
Mm-hmm.
Number two, we can have here hernias. Number three, we can have here bony fractures and traumas, because here we have vertebra, here we have the ribs. All these structures can be violated, of course. What else I can mention here, guys? Very high frequency of formation of skin disorders. By the way, the more downwards you will come near the gluteal region, the more will be incidence of this problem. What I mean? I mean carbuncles, furunculs, hydradenitis, atheromas, because skin is very rich to these structures,
Yes.
and the more you will come to the intergluteal fold, the more amount of this structure will be increased. More of these, the problems with the sanitarization of these regions. More of these, the friction plays with the clots. And all these mentioned problems make possible formation of the purulent processes, which can easily spread it from skin to the deep structures. More of these. Region is very near to the gluteal, but gluteal region, it is the place, most common place for intramuscular injections.
Yes.
And here also there are problems. Guys, do you see that in the last times, that is fantastical, guys. Size of the needles become more and more short. But unfortunately, size of our populations stand more and more big. So big phenomena, yeah? I need by 2 centimeter needle, push the 10 centimeters fatty tissue and reach the muscles. How? That's impossible. But unfortunately, majority of the medicines will not be normally absorbed from the fatty tissue. You know why? Because not so much vessels. Why we make injection into the muscles? Because muscles contain a lot of the vessels, and quickly medicine absorbs it and go to your vascular network. But fat doesn't have this specificity, you know? And a lot of the medicines which by mistake you will inject it in fatty tissue will be inflamed and can give possibly formation of abscess. And you know, little after I will tell you that deep layer of these two regions, I mean gluteal and lumbar, have communication to each other. And easily pass if the person in horizontal, of course, because if it is vertical by gravity forces, it is go down. But in horizontal position, it can simply continues into our region. And we, instead of the abscess, we will achieve the phlegmons. That's why keep it in your mind. I tell you all the importance of this region. Don't forget also that we can have some congenital or acquired abnormalities of the bones, some scoliosis. It can be in the region of the thorax, in the region of the lumbar. In the thorax, it's much more common. In lumbar, it's less common because thoracic region of vertebrae is longer. So the possibility of the violation and formation of the curvatures is more. But anyhow, we can have it here also. I think it's more than enough to prove you that the region is important for us. Now let's come to the borders and let's speak about projections and layers. It's very simple, guys. From inferior margin of 12 vertebra along with the inferior margin of the 12 ribs, we form superior border of the region. How much far laterally we go? Up to the middle axillary line, which is divided anterior and posterior walls from each other. Then you come to downwards, you find it the base of your sacrum, then you continue your line by the upper margin of the iliac crest, again up to the same middle axillary.
Yes.
From the sides will be the mentioned middle axillary
axillary.
line, which is border it from anterior region. That is the borders, I think it's not hard. From topographical point of the view, in majority of the books, you will find information that region, first of all, by midline, which is provided by spinous processes, split it into two symmetrical compartments, right and left. But there are second division also. I don't show it in the picture, guys, but if you will provide it right and left vertebral lines, you will achieve two parts of the region. It is the medial and the lateral. And you know why it's important? Because layers differently develop. I will ask you, if it's not hard now for you, put your fingers in your back and try to make skin fold. First of all in the medial compartment, then in the lateral compartment. And tell me please, where it is more easy? Of course. Of course. What it show? Point number one, skin is much more elastic and movable, but much more important, guys. Fat is greatly developed in the lateral
side.
and absolutely we can say absent in the medial portion. Evolutionally, it's very understandable. If your vertebra will be covered with big bulk of soft tissues, movements here will be not so easy.
Yes.
That's why, guys, your vertebra from backside covered with very small amount of the small tissues to make flexion and extension easy. This is the case why we need to make division into medial and lateral parts, because quality of the layers will, not quantity. Quantity will be same, but quality will be different. Is it understandable for you? Super. Very quickly, let's speak about the projectional anatomy. Primary, I want to mention about the kidney, suprarenal glands, pancreas, inferior caval vein, aorta abdominalis. And this is not hard. For the kidneys, guys, just remember that right and left is asymmetrical. Right is approximately into 3 centimeters descending to down due to evolutional influence of the liver. And if I will show for us attention between 12 rib and the kidneys, for the right one it will be like my pen. It's divided it into upper 1/3 and lower 2/3. In the left side situation another, it is in midpoint. It is split in left kidney into 2 equal parts. It passes approximately in the level of the pelvis. Say this 3 centimeter difference, keep in your mind, remember please. By the way, inferior pole of your kidney will reach approximately in both sides, the level of inferior margin of the 11 or upper margin of the 10. It will be the mentioned 7-10 centimeter of the length of your kidneys, if you will measure the axis of that. Suprarenal gland will be immediately in the level of upper poles. Pancreas will be approximately horizontal line in the level of L3. By the way, we know that it's not really horizontal.
Yes,
we know that it is passed from down to up, from right and left. And we know that finally tail is reached the level of T11, 12 ribs. So let's say this is not. If from two sides you will provide it vertical line, two sides I mean from vertebra. Right one will mention inferior caval, left one will mention aorta abdominalis. That is the main projectional structures which you need to know. Guys, let's say, look, again I tell you, I appreciated your logical thinking, but for that you need to have basic knowledge. Believe me, if you will have the base, you will not need to remember so big bulk of information, because you will be responsible to make your own conclusion, your own symptoms, your own association, but you need to have knowledge. Otherwise, all your conclusions will be in that level, which we see several minutes before. It will be your own created medicine. The question, who is needed? Who is needed? I appreciated your creative thinking, but your creative medicine will kill the patient. Why we need it? Because it is not our creation. This body, it's not our creation. We are not responsible to change it, dear. We are not responsible to improve it. We must to know it. So why you created the new structures? until now I don't understand. Say, I have two usual behaviors. Behavior number one and behavior number two. Both these behaviors are unacceptable. Behavior one, it is then the person close the mouth by the scotch and don't say anything. Behavior number two, it is free-thinking persons who start to creatively creating the new medicine. Unfortunately, behavior number three is so seldom. Then the person don't go not by the way one, not by the way two, but study the topics and answer normally the questions. This is so seldom today in our university. You don't even imagine. Let's continue. Okay, anyhow we understand the borders, anyhow we understand projections, divisions. Now let's speak about layers as usual. As usually we start from superficial, but here guys, keep in your mind, if you describe posterior structures, superficial one will be posterior. Then you describe anterior structures, vice versa, superficial one will be interior. This is important to understand. And the most posterior, or let's say most superficial structure will be skin. And as I tell you minutes before, in lateral parts, it will have different development. More medially you come, more it is thick and less elastic. More laterally you go, more it is elastic and movable and less thick. More down and medially you come, the more it will contain sweat and sebaceous glands and more hairs. By the way, even for mongoloid race, we have the hair triangle, which is directed by its tip into the fossa interglutealis. Very important because, guys, furuncles, carbuncles, different kinds of inflammational processes we can find in this region. And of course, all of them, it is surgically treated problems. You must make incision. Friends, I told you many times, unfortunately, because you don't listen your teachers, in the future you make a lot of mistake in the treatment of your patients. Now listen attentively what I will tell you now. Pus cannot be disappeared. Or it will come to outside, or it will go to inside. But it cannot be vaporized and disappear. Unfortunately, this simple rule always you remember in time of your practice. Fortunately, you think that if you will insert the medicine in the mouth of your patient, for example, antibiotics, due to this treatment, pus which exists will be disappear. No, friends, it is impossible. Maximum, what can you achieve by this? You can prevent formation of the pus, or you can stop the spreading and the enlargement. But if it is happened by the medicines, you cannot eliminate it. It's understand it, guys, and don't make the mistakes. There are the surgical rule. If there are pus, you must insist. Is it so hard to remember? Let's say, unfortunately, guys, for the deep structural units, simultaneous opening of the pus to outside usually is impossible. If it is small skin problem, always without any our help, it can find the way to outside by the perforation of the skin. But it doesn't work with the deep problems. It doesn't work. From your appendix, for example, pus cannot find the way to the skin. It will find the way to the peritoneal cavity and will give formation of the peritonitis. Samely in here, skin is very thick. If it will be deep pus, you must to make incision, you must to drain it. Otherwise, it can simply go too deep. Okay, anyhow, let's come to layer number 2, subcutaneous aspect. For example, in the first picture, you can see that layer, and you can see inside of it a lot of vessels and nerves, but you will not find any red line. Because in this region, guys, we don't have any arteries. Remember anterior wall? In anterior wall, we have arteries. 3 arteries, as you remember. Yes, superficial. but in the back only veins. By the way, all veins which you see here belong to the inferior caval venous system. They drain into the inferior caval. How? By the drainage into the lumbar veins. This is deep veins, which we will discuss after, but all these veins, it is tributaries of the lumbar veins. Lumbar veins drain into the inferior caval venous system. Nerves, which you see in this picture, they come from up to down, primary from medial to the lateral. That is the branches of the lumbar plexus. This is skin branches of the lumbar plexus. Vice versa, then you will go downwards. In the posterior surfaces of lower extremity, mainly, predominantly, you will see branches of sacral plexus. And vice versa, anteriorly up to the knee region, you will see the branches of lumbar plexus. Let's say this is the easy memorizational way. Remember, anteriorly we have lumbar, posterior on the left side for the lower extremity. Fat is differently developed, like the skin also. The more medial, the more poor fat, the more lateral, the more thick. And I want to say that sexually, this is also determinated, because for the females, it is much more have the, we can say, frequency to be accumulated in this region. Because for the males, much more commonly, fat is accumulated in belly.
Yes.
For the females, it is lumbar region, it is the gluteal region, it is the hip region.
Yes.
You understand that the estrogen and testosterone differently influence in the development of the fatty tissue. Usually, testosterone, it is depressed production of the fat. Estrogen, vice versa, it can stimulate the production of the fat. Because fat has hormonal activity for the females. It is producing the tissue hormones. We spoke about it, let's say keep it in your mind. And what I want to say, fat by superficial fascia here divides into two layers.
Superficial and deep.
And what is interesting, now let's imagine that his skin, I am proper fascia. Between us we have fat. If it's so, inside of this fat we will have superficial fascia, and it will split it, this bulk, into two compartments. By the way, much more bigger will be deep layers, and less developed will be superficial. More of this. From superficial fascia to the skin, we will have septas. The more medial, the more amount of the septus. The more lateral, the less. That's why laterally skin is better movable. Medially skin, less movable. Vice versa, in the deep layer, we don't have generally septas. That's a superficial layer we call pocketer.
Yes.
Deep layer we call layering. And immediately this deep layer continues into the gluteal region. And immediately this deep layer we call massa adiposa lumboglutealis, lumbogluteal fatty pad. And exactly this layer will provide the inflammational processes and will spread it between these two mentioned regions of the human body. Remember, guys, that is not so hard. Okay, if you understand it, let's continue. Now let's come to layer number 4. Layer number 4, which is called proper fascia. There are general rules, guys. Proper fascia called by the name of region. That's why we call here it's lumbar fascia, or we call it thoracolumbar fascia, because from thorax it is descending to the lumbar region. By the way, there are one more name for this fascia which you can find in literature, lumbar-dorsal fascia, because it's located in the back. Not just lumbar, but lumbar-dorsal. You know why this name is important? It is mentioned that proper fascia primarily located in dorsum. Because as you remember, in anterior abdominal wall, we don't describe it. No, of course, histologically it exists.
Very thin.
But surgically we don't describe because it's very thin and not developed. But in the back wall, it is greatly developed. More of this, I will remind you anatomy. This thoracolumbar fascia has two layers, superficial and deep. And each one gives the origin for one flat muscle. From superficial layer, as you remember from anatomy, I wish that you remember, we have the formation of internal oblique muscle. From deep layer, the transverse abdominal muscle. You know that the muscles started from aponeurosis. That's why here the fascia is so much thick that it has the form of the aponeurosis. More of these two layers of the proper fascia joined to the processes of the vertebra. You know, vertebra has two processes, spinous one and transverse. And it is enclosed the muscle which is between these two layers. Two processes, and which is called musculus erector spinae or sacrospinalis. This is the biggest extensor muscle of the human body.
Yes.
It's divided into three portions, as you remember from anatomy. And it is encapsulated between the two layers of the proper fascia, which is formed a sheet capsule for this muscle. Remember, please, superficial fascia, superficial layer, fused with the spinous process. Deep layer fused with the transverse process. And from the junction place, as I tell you before, they gives the origin for two muscles. Internal oblique, which will be more superficial, and transverse, which will be deeper. Is it understandable?
Yes.
I'm happy. Now look in the middle picture. In the middle picture, you can see the right one. You can see muscles. And if you will attract your attention, you will see two colors, the white color and the red color, because that is flat muscles. Flat muscles has muscular and aponeurotic parts. It will not be confuse you. And all muscles in lumbar region, guys, remember forever, we divide it into two groups. Let's say we describe two, I don't say two layers, I say two groups. Group number one we call dorsal. Dorsal, it means posterior. Or we can call it superficial, because what is in the back? Dorsal, it means superficial. What in the back will be ventral, it will mean deep.
Deeper, yes.
Let's say immediately group number two we call ventral muscles, otherwise anterior or deep
muscles.
Let's say once again, remember now by my two hands, I modulated two group of muscles. My left one will be dorsal, more back side. My right one will be more ventral, more in front. Let's start from dorsal group. Now remember please, muscles of dorsal group covered by fascia thoracolumbaris and partly originates from fascia thoracolumbaris, internal oblique and transverse. Muscles of ventral group covered by another fascia, which you know very well. How we call it? Let's say my opinion about your knowledge is much more better than reality. We call it transverse or end-abdominal fascia. As you remember, transverse fascia cover inner surface of the transverse muscle. And of course it is continuous to the back wall, because this is the part of the big endo-abdominal fascia which is covered whole wall from inside. Make the ring by your fingers. Make. And come to stand up. Ring. This is not ring. Now his ring show for us the parietal peritoneum. My ring, which is much more bigger, show for us the ring from end-abdominal fascia. And you can see that these two rings doesn't touch to each other. Between them we have space in anterior wall and in posterior. By the way, posterior space thrice bigger than anterior. Anterior space we call preperitoneum or Langenbeck. Posterior space we call retroperitoneal space. So remember please, imagine two rings, one inside of another. One small inner, second big outer. Inner ring, it is parietal peritoneum, which is enclosed the peritoneal cavity. Outer ring, it is end-abdominal fascia. Or in anterior wall, also we call it transverse fascia. Between them, because they doesn't touch to each other. By the way, they located to each other asymmetrically. anteriorly distance is small, posteriorly distance is big.
Big.
Do you understand me? Let's say dorsal muscles covered with thoracolumbar fascia, ventral muscles
Transverse
covered by
abdominal.
endoabdominal. Here, much more better here to call it endabdominal because transverse name primary we use for anterior wall. So if it is understandable, let's come to dorsal muscles and describe them layer by layer. The dorsal group of the muscles contain 3 muscular layers: superficial, middle, and deep. By the way, in superficial we have 2 muscles, in middle we have 3 muscles, in deep we have just 1 muscle. So remember, please. 2, 3, 1. I think it's not hard. Now look in these 2. This 2 is greatly visible, for example, in that region. This is one, the biggest flat muscle, which is called latissimus dorsi. This is second muscle, which you know very well. It is external oblique abdomen. Little enough. Latissimus dorsi originated from 6 inferior spinous thoracic, all lumbar spinous processes, base of the sacrum, and posterior 1/3 of the iliac crest. Muscular fibers pass from downwards to upwards, from medially to laterally, from back to in front. They come to the tuberositas minor of the os humerus and tendon of the muscle fuse. It means mainly adduction, as you remember. Okay. What about internal oblique, external oblique? You remember, guys, it is fused with the external surface of 8 inferior ribs. Muscular fibers directed differently in back and in anterior wall. In the back, they pass from medial to lateral, from above to below. In the anterior wall, vice versa, from up to down, from lateral to the medial.
Yes.
So it has bell-shaped form. And inferiorly, it is fused with anterior part of the iliac crest. More of these. Don't forget that it fused with anterior superior iliac spine. It makes duplication between spine and the pubic bone. And more of these in near of the pubic bone, it's split into 2 layers. So I show for you the biomechanism of formation of which ligament. What about I speak now? Which muscle I describe? Really? And my beautiful friend. Now take your beautiful bags and leave my room. Huh? Go now to the first floor, buy some very sweet juice and drink because brain needs the glucose for the normal work. Okay? Quickly. Friends, I don't need your sleeping in my class. I say in my class. Or let's speak together, or let's sleep together. I don't need to work alone. No, I'm very serious. Why I need your sleeping in my class? If you will tell me option, for example, if you will say, sir, I made beautiful your room, so I need to be here, maybe I will accept it. Otherwise, why I need you who didn't listen to me? Last 5 minutes, dear, I described the external oblique muscle, not any latissimus muscle. To remove your, no. What is your option? Do you need the juice or not? No. Okay, last time. Next time I will do it. Next time. Friends, I understand, it's not easy. Let's say I told you last time, again I say, it is just option which I suggest you. Find the person who told you previously that education in medical university, it is easy journey, and see what I will do for that person. Just say me the name, invite him into Armenia, and we will punish him together. I promise it for you. Because that one, I'm very sorry guys, I understand that maybe possibly it is your relatives, but you know these persons make the big problem for yourself. Biggest problem in your life. Because they make the, I'm very sorry, cheating stimulation of you. Because then my child decided to go to the medical university. I do my best to change her decision. I'm very serious. Because I understand so hard life she will have in the future. But God knows why you come here just for some vacation, some journey, very easy, very quick and very, very enjoyable. It's not enjoyable, it is hard work. How hard work can be enjoyable? It can become enjoyable in the future, yeah, if you will collect it huge luggage of the knowledge. If you will stand some prominent specialist in your field of the medicine, will have a lot of the monies, great respect in the society. In that time you will enjoy your life. But not now, guys. Now you don't have time for it. I'm sorry, forget about relax. How? You see, guys, I waste my time to explain it because I feel myself instead of your parents. How else to explain you? Do you know the proverb about donkey? Or 6 years donkey in medical university after you are host, or vice versa. 6 years you are host and all another your life you are just donkey. Now what is better for you? That is logical, guys. Now choose. Do you want to be 6 years hard worker or all another your life loser? That is so, friends. This is not my. I wish you easy life, but I understand that in the medicine it's impossible. If we will be now in US, you will go to the judge and say this person complained. No, I don't. Friends, I want to explain for you reality. Reality. This is reality. And now, guys, attract your attention to another reality. You know what the problem? Due to the different attachment of these two muscles to the iliac crest, in the mid part of this iliac crest, up to approximately 5-6 centimeters above, we don't have layer number 1 of the muscle. You know why? Because latissimus dorsi and external oblique doesn't touch to each other. Because one is touched to the posterior third, another to anterior third. What about middle third? Middle third from upwards doesn't cover by first layer of muscles. And you can see formation of triangular shape B-space. You see it? Which is called lumbar triangle. Lumbar triangle, that is first weak place in the lumbar region. This is first weak place. Am I prove you that it's weak or no? Repeat please. Why the B triangle? Look in the picture. Recognize triangle B and explain me please why it is weak. Dear, do you listen what I tell just before? Today you waste all your future. You waste your future. Until now, you see guys, so many times I try to influence into your behavior. But until now you sleep. You just don't want to listen. Tell me please why this triangle B in this picture. Do you see triangle B? Why it is weak? Break, please. Because you start greatly. Because it's so beautiful. Because what? Great, you are so young. You can so interesting provide your life. Why you choose the profession which you don't love? Why? You don't like this profession, you know, because in the time that I speak about, look, not theoretical, but practically important questions, because you can have such kind of the disorders in your patient body. Then I explain you some apply knowledge. In that time you sleep. Tell me please, why you waste your life? Maybe you can have the big success in other spheres. Why you come to some specialization which you don't like? Why? Why, brains? I so long speak about the necessity to change your behavior. Then I describe something. It's, you know, it doesn't need any previous knowledge to answer in my question. You just must be attentive and listen what I speak. Dear, you can damage your joints to be attentive. Do you understand? Friend, explanation is more than simple. Weak place, it is the place without some layers. Especially it is belong to the muscular layer because it is strongest protection against formation of the hernias. Now look in the triangle B, friends. As you can see, two muscles which is located in layer 1, latissimus dorsi and external oblique, doesn't touch to each other in the region of the middle third of the iliac crest.
Yes.
Now let's imagine that he is one muscle, I am second muscle. Do you see the distance between us?
Yes.
Does it contain muscular layer, this distance, or not? Yes or no? Of course. Does it make this compartment weak or no? Super answer. That's a region of triangle B is weak because first layer of dorsal muscles absent. They absent. Now look in the borders of the triangle. It's so simple. From back side, it is lateral margin of the latissimus. From in front, it is the posterior margin of the external oblique. From downwards, it is the iliac crest. What is the floor of this triangle? If you will look through this window, you will see second muscular layer. Immediately, this is internal oblique. What is the roof of this triangle? Roof, it is the promarcation, which is cover these muscles. We call it fascia thoracolumbaris. So I border this triangle from all possible places. From medial, from lateral, from down, from superficial, from deep. What else do you need? Now let's remove the layer number 1 and let's see what is located under of the layer number 1. For example, here we cut the aponeurosis of the latissimus dorsi, and under of it you can see one longitudinal, very powerful muscle, which you call musculus erector spinae, or sacrospinal muscle. It's located inside of the sheath. As you remember, I told you, from one side it's superficial layer, from another side it is deep layer. They enclose the muscle and forms the capsule.
Yes.
Muscular fibers pass absolutely longitudinally, starting from your cervical portion up to your lumbar portion, and then finally come to the sacral portion and finish it. If we will cut the latissimus dorsal laterally, you will see two other muscles. Both is oblique, one and second. Upper muscle we call serratus posterior inferior. Serratus posterior inferior originated from two inferior thoracic and two superior lumbar spinal processes. Muscular fibers pass from down to up, from medial to lateral, up to the lower 4 ribs. And insertion place, it will be the back surface of the level of ribs 11, 12, 9, 10. Lower 4 ribs. That's a muscle pass from downwards to upwards, from medial to lateral. Tell me please, in the base of this information, which kind of muscle is it? Inspiration or expiration? Inhalation or exhalation? Absolutely correct. Listen her and say the opposite. Of course, it is inhalation of muscle here. Because then you make inhalation, your ribs descend
Down.
If the muscle started from down and inserted to upwards, then it will be constricted, rib will be descending to down. Vice versa, if the muscle start from upwards and finish downwards, then it will be constricted, ribs always muscle during constriction make the work towards the origin, not towards the insertion. Remember guys, it's not hard. So if it is inserted higher than it's originated, bones during constriction will be decreased. Vice versa, if it is inserted down than the place of the origin during contraction, they will be lifted.
Yes.
Is it understandable for you, my dear friends? This is two muscles. There's a next muscle, you know very well, it is internal oblique. You remember several minutes before we described it as the roof,
lumbar
for the
lumbar
triangle.
triangle.
Friends, internal oblique we study so much.
Yes.
From upwards, it is the inferior surface of the costal arch. It is the level of the 12 rib. By the way, very interesting muscle. It has fan-shaped direction. Inferiorly descending, medially horizontal, posteriorly and superiorly. It is ascending. Ascending. And what is important? Again, guys, inferiorly, it is fused with the anterior part of the iliac crest. And what is important? Lateral 1/3 of your inguinal ligament. That's why space is formed. Do you remember inguinal space? Along the inferior 2/3 of your inguinal ligament. Why it's happened? Because two flat muscles doesn't fuse with the inguinal ligament here. It is internal oblique, it is transverse. They fuse. You understand what I tell you or no? You understand? Tell me please, why inguinal space is formed? Explain me please a reason of formation of inguinal space. No, here, no. Again, you sleep during my explanation. Time to time, you make the show that you listen. You so attentively look, but that doesn't mean that you listen. Dear, stand up. Come to me. Come on. Come, stand up here. Hold your hand like this. No, that hand. No, stand up by face there. No, obliquely, from up to down and from lateral to medial, like little upper. Okay, this is inguinal ligament. Now what is happened with this ligament? Look attentively to me. Let's divide it imaginarily into lateral, medial, and medial parts. Yes. And now everybody look to my hand. My hand, it is two flat muscles. If my hand will be totally fused with the inguinal ligament, we will not have any space. Unfortunately, I don't have marker to draw. That's why I use what I have. That's why what is happening here? My cubital region and her cubital region fuse to each other. But along the inferior 2/3 of the inguinal ligament, between my and her hand, we have the distance.
Yes, please.
Sit down, please. You understand? Let's say what is happened here. In the lateral third, inguinal ligament and muscles joined to each other. In the inferior 2/3, they doesn't connect it, and the space is left, which is called inguinal space. Inguinal space, dear, it is space between roof and floor. It will be space between roof of your inguinal channel and between floor. Let's say consequently, these two muscles will be roof, inguinal ligament will be floor. In front of us, we will have external aponeuros, anterior wall. Behind of us, we will have transverse. Do you remember, friend, 2 minutes before? Okay, not 20 minutes before. I told you that inner surface of transverse muscle covered by transverse fascia.
Yes.
If transverse muscle now located upwards, back to us, we will have transverse fascia. Because next to transverse muscle, we have transverse fascia. Now you can imagine this 3D picture of this channel. One structure up means two free margins. One structure down means the inguinal ligament. One structure in front, external aponeurosis. One structure behind, transverse fascia. Do you understand me? Are you sure? And what is happening, guys? Again, problem. You know what the problem? I told you that posterior, inferior serratus fuse with the spinous processes of only two upper lumbar vertebrae and two lower thoracic. But it doesn't reach to the sacrum. It doesn't reach to the inferior parts. That's a between your internal oblique, which is from iliac crest, and between your serratus, which is from upper two lumbar spinous. Again will be distance.
Yes.
Again they will not touch to each other because your serratus doesn't reach to the iliac crest. Do you understand me? Let's look now into this weak place. As you can see, it has a rhomboid shape or quadrangular shape. And what will be borders of it? From upwards, inferior margin of serratus. From downwards, upper margin of internal oblique. From medial side, it is a rectus spina inside of its capsule. From lateral side, it is 12 rib. Do you see? We call it lumbar quadrangle. If previous one is triangular shape, this is quadrangular shape. By the way, bigger than the previous one. Bigger. Now again, let's speak about the roof and floor. Roof, it is of course aponeurosis of the latissimus dorsi, because here it is catit. And floor of it, of course, it is the next third muscular layer, which is transverse abdominis. That's so simple, friends. That's so simple. Just try to remember and use your imagination. Now we go deep. And by the way, if you will look attentively, you will see that inside of this quadrangle, we have the last intercostal, which is called subcostal neurovascular bundle. Because it passes immediately by inferior margin of the 12th rib. It means it should be inside of this triangle because 12th rib forms the border of it. Friends, I don't know. And let's go deeper. Now we remove second layer also. Under of the second layer, you see absolutely horizontal or transversely directed muscle. It's originating from the deep layer of fascia thoracolumbalis. It is fused with the spinous processes of the lumbar vertebrae. Because as you remember, deep layer of thoracolumbar fascia fused with the transverse processes of the lumbar vertebrae. Then it continues. It is continuous, guys. It is fused with the inner surface of the inferior 4-5 ribs. It comes to the anterior wall. In the anterior wall, near the lateral margin of the rectus muscle, it is become to aponeurosis. By the way, in the back, it also has aponeurotical part. Medially, it is aponeurotical. Laterally, it is muscular. All these flat muscles have antaponeurotical parts and muscular. That's all. We finished to describe together, guys, the dorsal group of the muscles. Now let's become to the ventral group. To describe the ventral group, guys, I must or to remove all dorsal muscles, or much more better, I must to remove the parietal layer of the peritoneum, which is covered posterior wall with retroperitoneal space, and we'll look from in front into the lumbar region. From inner side. For example, in this picture, you see immediately that picture. We remove the peritoneal cavity. We remove the fat. Abnormal. I cannot move this mouse. We remove the fatty structures here. And you see two muscles. 1 and 2.
Quadratus lumborum.
This is quadratus lumborum. This is
16,
psoas, minor
psoas
and major.
yes.
By the way, not all peoples have this division. Approximately 25-30%, it is one common psoas.
Psoas.
By the way, you can see that it down continues and fused with iliac muscle. And together they form iliopsoas,
Psoas.
which is come to the anterior medial surface of femoral region. In the future, we will describe
Triangle.
it in the anterior medial. It forms the floor of your femoral triangle. Two muscles we have on the floor. Medially it is pectineus, laterally it is iliopsoas. And quadratus lumborum, you can see.
Yes, quadratus.
Both these muscles covered now by endo-abdominal fascia, not by thoracolumbar one, but by endo-abdominal. And what is important, guys, two arches forms. Unfortunately, it's invisible, but if you will look to the place of attachment of the diaphragm, because it is descended up to the lumbar portion, and fused with the transverse process. Two arches you will see. Lumbar costal medial, it started from L1 and come up to the transverse process. And lumbar costal lateral, again from L1, but come to the 12th rib. And lumbar portion of your diaphragm immediately pass under of these two arches, and fuse with the consequently vertebrae and finished here. And what is important, guys, inside of capsule of these two muscles, there are neurovascular structures. Inside of the capsule of quadratus lumborum, here, guys, we have three structures. You know all of them. It is ilioinguinal or iliohypogastric nerves, which is originated from lumbar plexus, L1. And this is the subcostal neurovascular bundle. Before come to the lumbar quadrangle. It is located just in the anterior surface of musculus quadratus lumborum. What is happened with ilioinguinalis, iliohypogastrica, you know. Both is come to anterior wall, localized between internal oblique and transverse. Then ilioinguinalis from roof of the inguinal space enter inside of the space. Iliohypogastrica penetrated muscles come to the fatty tissue and innervated skin and subcutaneous fat. It is sensory. By the way, both these nerves reach also to the anterior medial compartment of upper femoral region. And they also make the sensory innervation of the most upper and medial compartment of the femoral skin. Inside of the capsule of the psoas major, we have the genitofemoral nerve, also from lumbar plexus. Remember, it has another pathway. It goes to the Langenbeck space, split it into two branches, ramus femoralis, ramus genitalis. Genital one from inner ring of inguinal channel enter inside of the channel. For the males, it is inside of spermatic. Finally, come to external genitalis, make the sensory innervation. Ramus femoralis pass behind of inguinal ligament. You remember, behind of your inguinal ligament, we have subinguinal space. That is my pelvic bones. That is my inguinal ligament. That is my subinguinal space. That is arcus iliopectineus. And you remember from anatomy, lacuna musculorum, lacuna vasorum. Lacuna musculorum contain iliopsoas muscle, which after come to the type. Lacuna vasorum to my fingers. It is femoral artery, femoral vein. I think you remember your anatomy. And between them, we have ramus femoralis, the genitofemoral. Again, come to the skin in the medial. That's an upper third of the medial surface of the thigh, innervated by three nerves. Genitofemoralis, ramus femoralis, ilioinguinalis, iliohypogastric. Primary, what I want to tell you, vascularization innervation is more than simple. Lumbar vessels, lumbar arteries, it is the pair branches of aorta abdominalis, supply not only lumbar but anterior abdominal wall, again localized after between internal oblique and transverse abdominal muscles, as you know. Veins consequently drain into the inferior cavern, but from upper lumbar veins, you know from anatomy, ascending the lumbar vessels is originated. In right side, it is the origin of azygos, in the left side, hemiazygos. And due to this origination, guys, or a connection, okay, call how you want, but anyhow, cava understands. Because azygos, hemiazygos drain into superior caval
Caval,
system, lumbars into inferior caval system. That's in that level. We will have, this is level of T6, T7, yeah? We will have formation of cava
anastomosis.
Innervation, I told you before, it is primary branches of the lumbar plexus. Do you have any questions? Unfortunately, my time is over. After 2 minutes, it will be finished. I don't have time to speak about retroperitoneal space. Read it, guys. Read it, please. I will not include it in your control because I don't describe it. What is described strongly will be in your control.